partner with Johnson & Johnson to bring you some of this information today. And, prostate cancer, we talk a lot about screening and the importance of finding it early in its stage. But what we know is that prostate cancer in some men will spread or will recur. And at that point, the really important thing to understand is that question of, is it still responsive or sensitive to hormone therapies or not? Testosterone is the main hormone that feeds prostate cancer, that stimulates it to grow. So many of our treatments, including Erleada, are designed to affect that ability of testosterone to stimulate the cancer. So understanding if you're hormone sensitive or not is a really key component for those patients who have cancer that's spread beyond the prostate.
The treatment journey started with a surgical removal of the prostate. And then in later years, after the prostate cancer had returned, we radiated it out with very intense radiation. And during those years when we were getting ready to use the radiation to get rid of it, I had the opportunity to speak with the care team on and off for 4 years about what treatment plan would work for me once we did radiate it out. Which involved the combination therapy involving the same drug Doctor was speaking of earlier, the Erleada. So it's a combination therapy I'm 4 years plus into that treatment, and there's no signs of any negativity whatsoever. I'm in good shape. The head nurse asked me one day if I would speak with patients on their way out of the advanced prostate cancer clinic, and I said yes. So if they approach me, I will speak with them and give them support, let them know they're not alone, share information with them about questions they can ask their doctor, vetted sources of information that will allow them to learn more about it, discuss it with their care team, and actually map out their own journey with the care team.
So real-world evidence is looking at how treatments are affecting patients and how patients are doing in everyday clinical practice. And it adds to what we get out of the clinical trials that are much more structured and generally are what lead up to the approval of a medication. So real-world evidence allows us to really understand questions that may not otherwise be answered and look at a broad set of patients in the real world and how they're doing, and can really help inform doctors and patients about what might be a good option for them. It's always extremely important to have a conversation about the risks and benefits of treatments like Erleada and others that may be beneficial. And real world evidence gives another layer of information to say, hey, how are people really doing in the real world on these treatments? We know that there are questions we always want to ask that we don't necessarily get from clinical trials, and I think that's what we're trying to answer through some of the real-world evidence studies that we're doing. I do think it's also we have a very curated group of patients in a clinical trial. They just by necessity have to fit into very specific buckets. Whereas in the real world, we're often dealing with a lot of different complexities, et cetera. So I think the real world evidence can be very helpful in supporting clinical trial evidence to make people feel confident that they're going to get the responses that they want. And that's true both for the patients and the doctors.
Start with building a support group themselves. Build it with your care team, build it with your family, build it with other prostate cancer patients. You're going to learn a lot by speaking with people in these three different groups, a lot of which will help you actually communicate with your family members and help put their minds at ease. So that's the biggest thing, is to build that strong group and then go online with as we were talking about earlier.
And patients should always talk to their doctor, understand the risks, the side effects, the benefits of different treatments, and look for a specialist if you have more questions that you want to get answered. You can go online to erleada.com, that's ERLEADA.com, for more information about that treatment and general information about prostate cancer. And this is Prostate Cancer Awareness Month. If you haven't been screened, you should have that conversation with your primary care doctor as well about getting tested for prostate cancer.